Between the toes here again, there, and there, and so that's good. So that's the basic inspection there, okay? Palpate bony landmarks, okay? Laterally. Okay, so let's just kind of relax your foot out there. Okay, so first one here, actually the fibular head here. So again, so that's right there. You can feel that. If you guys remember your trick during your knee exam, you can do a little heel flick, and you can, I don't know if you can see that moving there. See that fibular head moving as I do that? So I'm just feeling over that. Is there any tenderness there? Essentially is the question, okay? And then looking at the lateral side here, so starting proximally, any tenderness here along the fibula here, and then feeling over the anterior surface of the lateral malleolus, kind of the distal portion, and coming around posteriorly for that bony landmark there, and then just right on that bony nub there. Then usually it's pretty easy to go down here to the base of the fifth metatarsal, and if you just run your finger on the side here, you'll notice sort of a natural divot there, and then you'll come onto some hard feeling thing there, and that's the base of your fifth metatarsal. Okay, and then superiorly here, the navicular bone is right here anteriorly, and again you can feel that there's a navicular tuberosity on there, and you can kind of just feel here right in that area for the navicular. Okay, and then I'm going to go medially here. Actually, maybe I do it on this foot here. So there's the navicular there, and then again the medial malleolus there. You can see that there. Usually you'll start up high and just kind of feeling down there right off of it. Feel a little bit anteriorly and a little bit posteriorly. Just feeling that thing, pushing on it, giving it a pretty good push. I'm giving a pretty good push, aren't I, Henry? There? Yeah. And then let me go back to this one here. Are we doing the metatarsal heads now? Yeah. Metatarsal heads. Okay. So again, so just being very specific about feeling them. Sorry, is that working? Oh, sorry, am I blocking your view?
I'm just trying to figure out the best angle for this.
Yeah, because then you're in the middle of the...
Yeah.
So first metatarsal, okay, and so based on the callus formation here, remember there's callus at the second metatarsal head, and we're also seeing a little bit of a claw deformity there of that second toe. So we know that there's probably a little bit of tenderness there if he comes in with some metatarsal tenderness there, but again, it's right between my fingers there, and I like to feel on the plantar and dorsal and the dorsal surface. Metatarsal heads. Is any of that tender, Henry?
No.
Okay. And you see there's also a little bit of, you can get a little callus formation on top of that PIP joint there. And then, so I think is that all my bony landmarks? Okay. And so then after my bony landmarks, I'm going to go to
soft tissue landmarks.
Soft tissue landmarks. Okay, so I'm going to do my ligaments, and then I'm going to do the Achilles. Okay, so this is so you got to be very specific here on your ankle ligaments here during the testing here. So we're going to do the ATFL is right here. Okay, so that's the anterior talofibular ligament, and then right here, just right off the end, is the calcaneofibular ligament, or the CFL. Okay, and then posteriorly you've got your PTFL, your posterior talofibular ligament. Okay. Any tenderness in there, Henry?
No.
Okay. And so then medially here, let's do the deltoid ligament here. So, again, that is, instead of three separate ligaments, it's one big fan-shaped ligament here, and it's called the deltoid ligament. It's just, you want to feel anterior area that's in sort of the corresponding CFL area and the corresponding PTFL area. So it's just one big ligament there. So you're just feeling that whole thing there. So it's pretty unusual to have a medial ligament sprain, but you'll see them every once in a while. People stepping on your foot, or funky cuts on the turf, that kind of thing. But again, you're mostly going to get the lateral inversion injury. Okay? So then I'm going to go between the metatarsal heads. So again, I'm feeling the soft tissue between the toes here, like that, and in between there, in between the metatarsal heads. Okay, and that Morton's test, again, is to just compress the foot like that. So if there's a Morton's neuroma in there between the third and fourth metatarsals, you'll be compressing that, and that'll cause pain. So I'm just squeezing like that. So squeeze. Okay, that's a Morton's test. I don't think it's on your list though. What's that?
It is.
It is
a squeeze.
Morton's squeeze test. Okay, and then the Achilles test here. Again, so we're just going to feel along the Achilles here. You can kind of push on it and watch that plantar flexion there as he does that. So I'm going to just be feeling along that, and you kind of just go all the way up to the gastroc there, and just kind of feeling in there, and any tenderness, and then feeling that insertion here on the calcaneus, because people will get a lot of tenderness there. Okay. Then am I doing the plantar surface? The
posterior talofibular. Oh, we did that one. The deltoid ligament.
Deltoid, we got posterior tibialis tendon. Okay, so we'll do our tendons here. So we'll do the peroneal tendon here, which is right, essentially along right in here, and comes down here on the fifth metatarsal base. And again, we're just feeling up high in here, down behind the posterior malleolus, and come down and feeling right through that track right there. So people will often, when they get the inversion injury, they'll get pain all the way up their calf sometimes, and they've just injured that tendon, strained some of the muscles up in there. Okay, and then medially here, you're going to get that posterior tibialis as the medial side is the tibia there. So again, it's just right along up in here, and then right down, right behind there, and then it attaches at the cuboid right in here. You can feel that little tubercle there. Okay? Questions about that one?
What was that you were just doing?
So that's the posterior tibialis tendon.
Okay.
Hmm?
Right.
No?
Yep. Oh, okay.
Tubi.
Gotcha. Thank you.
Okay, and then the other soft tissue stuff here on the end here, so or on the bottom of the surface here. Sorry about that, Henry. So this is the classic sort of insertion. People will have medial heel pain for that plantar fasciitis, and that's where they're going to be the most tender. So you push on that, but you do want to feel all the way along the plantar fascia. So you just work your way distally from that medial heel position all the way. Okay, and again, that's a fan shape sort of thing. Yeah.
With the plantar fasciitis, so if they're seeing you in the afternoon and they've already been walking around and it's loosened back up, are they still going to have pain and tenderness there?
Mm-hmm.
Okay.
Yeah, definitely. It's a very tender thing. So I think that's all. Is that all the soft tissue palpations here? Okay. So now we're going to check the dorsalis pedis pulse here. So it's right there, just in between the first and second metatarsals bases. He's got a nice, strong, bounding pulse there. We'll check capillary refill here, and then we'll check the posterior tibialis pulse here as well. And so typically we'd be doing these bilaterally, comparing them side to side. And pulses. Just put this one. I'm not feeling this one here. Yeah, there you go. It's just easier. So there's the same side to side. And then, so I'm not doing any of my range of motion and muscle strength here. Okay, so I'm going to just kind of hold up your, can you point your toes up at your ears, okay, and push them down as far as you can. So that looks like pretty good range of motion there, and I'll compare side to side. Put your toes up there, push it down so it's active. And then passive, I can kind of feel some of that. If active was impaired, I would do the passive range of motion there, okay? And then am I going to do strength here too?
Evert and invert.
Okay, so this one actually is easier if you're dangling, Henry, so let me just try. So essentially what we're trying to do here, so I like Andrew's idea about just tell him to hold your foot right in one space there. So essentially I'm going to test inversion and eversion. So just try and hold your foot right in this spot, Henry, and don't let me move it. Just keep it as tense as you can. So testing eversion, testing inversion. Okay, so I'm just trying to turn it. So you can also have people, push your hand against my hand there, so you can have them push that way, and then you can have them push medially. So what I'll usually do if I'm going to do it that way, so just relax for a second, Henry. So I'll just kind of start with their foot here, and I'll say, push against my hand. So that way they know which way they're supposed to be pushing. Okay, and I'll stabilize it here, and I'll just relax here for a second, Henry. Push his foot out, and then just push against my hand here on your toe. There you go. You can kind of see that. So this test is the inversion, eversion is a little bit hard. When you're testing the muscle strength for inversion, for plantar flexion and dorsiflexion, I usually just like to have people stand up and, can you go up on your toes? Can you go up on your heels? So we're
Sensation, sharp, dull.
So sensation, sharp and dull. Do you guys want me to go through that? So essentially, it's so you got the. I don't have a Q-tip here. Do you have one here? So Henry, this is going to be. Well, I don't want around me. Yeah. So sharp and dull. So I would say. So close your eyes. Tell me, do you feel sharp or dull? And I would put L4, L5, dull. And S1. Sure. And again, so the mistake is to bounce it on there. You just want to apply steady pressure, sharp or dull. Steady pressure, sharp or dull. Okay. So that's sharp and dull sensation. And by the way, so I'm also inspecting, hair loss, pallor, edema, signs of infection, that kind of thing. Thompson test here. Why don't we do the anterior drawer and the talar tilt, and then we'll go do the Thompson test here. Okay. So you can see how his foot is sort of naturally plantar flexed a little bit, and that's the position for the anterior drawer. So I'm going to stabilize here in the pretibial area, and I'm going to be pulling this direction, and I'm going to keep this hand here. Okay. So that's going to be essentially what I'm trying to do is to translate that bone or the talus along the tibia. Okay, so that, and then again I would be comparing side to side here. Okay, and then dorsiflex the foot and do it at 90 degrees as well, because you don't want to miss some of those inner ligaments there as well. Okay, so essentially I'm trying to pull this way and stabilize, holding this in place and pulling this way and feeling for laxity. Questions about that?
You have to do it in both.
So you want to, in a little bit of, you want to do 20-30 degrees of plantar flexion as well. You can test in that anterior talofibular ligament. You go up at 90. You're still testing the anterior talofibular ligament, but you're also getting some of the calcaneofibular, or the talar tibial ligaments as well. So if you go in to your orthopedic surgeon, they'll tell you to make sure you do it at 90 because you can miss an unstable ankle if you don't do it at 90 in both, or 90 and 20 to 30 degrees of plantar. Talar tilt here again. So we're testing the CFL or the calcaneofibular ligament. So essentially, I'm just trying to invert that and feeling for the laxity. And so sometimes people will do it sort of side by side to kind of compare side to side. You can do them one at a time. I generally like to put my thumb on the medial malleolus and just kind of feel down. You can feel on the other side here for that laxity, and he's got some good tight ones there. You can kind of feel in here as well. Some of you feel that joint space open, and typically you're doing it several times if they'll let you to see if you can slide that or translate those bones. The last one here is the Thompson test. So can we have you carefully...
You want me to kneel on the chair?
Yeah, that's a good idea. That's a good idea. So we'll have you kneel on the chair here. So somebody should hold the chair here. Okay. So the Thompson test again is a test for the integrity of the Achilles tendon. So you just watch here. He's got an intact Achilles tendon. So what's the response you expect? Plantar flexion, right? So we got a little bit. Okay. Okay. Let me see that. Negative Thompson test. Okay. Good. Thanks, Henry.
You want to show us how you'd evaluate his shoes?
And then so let's take a look at Henry's shoes here. Yeah,